Good morning. Well, I think we should get going. Welcome, everyone. I know others are going to be joining us, but let's get started. I'm just so honored to have Holli Seabury here, and I'm gonna do a brief intro. And before that, I should say I'm Nancy Frank Wilson. I'm with the Minnesota Oral Health Coalition. On behalf of our board of directors and our 600 plus members, I want to welcome you. This is what we call an infomar, just because I wanted to have our own name instead of webinar. Created the infomar idea. So our presentation today, as you can see, is social determinants of health, how they are impacting your practice and strategies to lessen their impact. Holli Seabury is the executive director of the Delta Dental Foundation of Michigan, Ohio, Indiana, and North Carolina, which is dedicated to oral health equity and advancing dental science through education and research. Dr. Seabury has over 20 years of experience in the nonprofit field. From 2009 to 2019, she was CEO of McMillen Health, a nonprofit health education center serving over 90,000 annually. She was the lead curriculum developer for the Brush Oral Health Program, which serves over 1.85 million children nationwide through early Head Start, and WIC. Her work has focused on health literacy and developing educational materials for the Medicaid population, especially young families. Dr. Seabury holds bachelor's and master's degrees from Defiance College. In 2015, she earned a doctorate in curriculum and instruction with a specialty in educational technology from the University of Florida. And I would also like to say thank you to Delta Dental Minnesota Foundation for making this event possible. And one last housekeeping issue, we are going to record this so we can post it on our YouTube channel. And if you have questions, if you just put them in the chat, I'll make sure that we manage them as we go. All right. Thank you. Take it away.
Thanks. Thank you for having me. I was saying before we got started that, this used to be like my job. And I did a ton of education, and now I get to do it less frequently. So I really enjoy it when I get to do it. So I appreciate being asked. And this is one of my favorite topics. One that I've been presenting on for a number of years. I like to start by what are the social determinants of health. I think by now we've all heard this phrase. When I first started talking about this, no one had heard the phrase. And the research was just starting to come out. But now I think we've all heard the phrase, the social determinants of health. But I still like to give the definition in case you're not 100% sure what the definition is, but it's the social determinants of health are really what determine your health, and they're shaped by the distribution of money, power, and resources, not only in our local communities, but also in the world. So some of the social determinants are shaped by national policies and legislation and national funding. Some are shaped by state, and a lot are shaped by our local environment. So what are they? There are literally dozens of social determinants of health, but these are some of the big ones. Number one is income, your education level, your gender, your race, whether or not you have a disability, your housing situation, are you food insecure? Is English your native language? If not, that's going to impact your ability to have good health. Nancy was just talking about neighborhood safety before we got started. That's huge. What is your neighborhood environment like? What is your employment, your working conditions like? What is your access to health services, your access to healthy food? So all of these types of indicators, are what determine our abilities to be healthy as individuals, and essentially as states and nations too. So I don't expect you to read all this. I'll kind of summarize it for you. I was really interested when the American Academy of Pediatric Dentistry came out and said that they recognize the influence of social factors on children's oral health, including access to care, dental disease, oral health inequities, and they encourage policymakers and oral health professionals to take those into consideration. This was kind of a big deal because my background is more coming out of social work and early intervention, where we understood these social determinants really, really well, even before they had a name. We understood that where people lived, their education level, their income level was really going to impact their ability to be healthy and their children's and impact their children's health. So we really got this. But when I started talking about this to oral health professionals, and I'm not an oral health professional, the pushback I got was, no, this has nothing to do with your oral health. You either make a dental appointment and go, or you don't. None of this stuff matters. But as we're realizing now, yeah, this stuff matters a lot. So I like to talk about this example because it's not oral health related. And I think sometimes people are able to grab onto something a little bit more when it's outside of what they're immersed in day to day in the oral health field. But this is a young man who made the national news. He died at age 26 because he couldn't afford to pay for his insulin. He was working in a restaurant as a manager. He could not afford the health insurance that they offered. He could not afford the deductible. The insulin was $1,300 a month. And when he aged out of his parents' insurance, he could no longer pay for his insulin. He started rationing his insulin and he died. This happens, unfortunately, all the time. In fact, 34 million people in the US have diabetes. 1/4 of them report rationing their insulin because they can't afford it. Much more likely than to have, obviously, if you're rationing your insulin, you're much more likely to have problems controlling your blood sugar and the associated health effects with that. But here's what's the scary part. 1 out of 3 people who cannot afford their medication and ration it say they never talked about this with their provider. Typically, the reason they've never talked about this with their provider is they were never asked. So that's a lot of what I talk to, is that very intentional asking people about what's impacting their health. So how does this impact your world in oral health? 1 in 5 cases of total tooth loss are linked to diabetes. So basically, if you've got patients that you're seeing or that you work with who are rationing their insulin, they're at much higher risk of losing their teeth. So it's impacting your work, even though it's their insulin, not their dental appointments. So this is kind of how all of the social determinants of health are interrelated, because we all know by now that you're not going to see somebody with perfect teeth who has horrific physical health. This stuff is all intertwined, interwoven. We can't separate our mouth from the rest of our body, even though insurance would like us to. It just doesn't work that way. So this is what I mean when I say ask. There are a lot of social determinant screenings right now. I really encourage every single person who's working in direct service and seeing individuals to do a social determinant screening at the first visit, or regularly if people pop up as yeses on these screenings. Somebody like me who does one of these screenings, everything's a no. You probably don't need to rescreen me unless something changes dramatically in my life. But for people who are popping up as, yes, I don't have enough food. I have trouble paying my heating bills. I have trouble with transportation. Those are people you're going to want to screen on a regular basis, maybe even every time you see them, just to know what barriers are going to be in their way. Because the reality is, the more yeses you see on a form like this, where you're asking, do you have trouble paying for your child's medicine? Do you need help managing your stress? Do you have family or friends who can help give you support when you need it? The more yeses you're seeing on a form like this, the more likely you are to have no-shows, incomplete treatment plans, someone who's not compliant with home care. And why is that? Because they're dealing with a lot. if you answer number one, are there times when you don't have enough food for your family? Trust me, preventive dental care is not high on your list of priorities. Feeding your kids is high on your list of priorities. And that's as it should be. Because, and I know no one in the dental world likes to hear this, but it is more important that people eat than have preventive dental care. But ideally, we want people to have both. We want them to be able to eat and get preventive dental care, but we need to know if that is what's going on, because then we know that this is a person struggling with a lot. So what do we do in this case? Well, we have to be prepared to send them to the right place when they answer these questions. So we need to know where to refer them for food assistance. We need to know where to refer them for housing assistance. Luckily, it's often the same place. And so, often we're able just to do like a one-stop referral. But we need to, when you ask these questions, you always have to have a referral, because the worst thing is to ask these questions, find out people aren't eating enough, and then not help them. Because that does no one any good. This is actually a WIC screening that I worked on when I was in my previous job. And that's why there's a lot of children's questions on this, because everyone who was answering the screening had young children. There are different screenings. I'm working with one right now. We have a project going on in a nonprofit dental clinic, a low-income dental clinic, where they're doing a screening. I'm going to say, though, the questions are always similar. We're asking about food, transportation, mental health, but these are great. So I always ask, if you do an intake form like this, if you're working in direct service, and do you think you might get better results if you did an intake form and you knew the barriers that your patients were facing? So for instance, if somebody says, I don't have access to transportation, okay, that's going to be a problem with completing a treatment plan. So that's going to have to be taken into account of how are we going to get you here, So then this is always a real fun one. This is the social disparities of health created by providers. So we can also create social disparities of health by not accepting Medicaid, which limits access to dental care, accepting Medicaid, but treating Medicaid patients differently. So they're very uncomfortable coming in, and they don't want to come in or feel good about coming in. Front office staff is critical to patient care. And I don't think front office staff gets enough attention in the oral health world. We talk a lot about dentists, and then we talk about hygienists. And if you're lucky enough to have dental therapists in your state, like Minnesota does, we talk about them, and we talk about assistants. I almost never hear a conversation where we talk about front end staff. And yet they are some of the most important people in a dental practice or a nonprofit dental clinic, because they're setting the tone for patients. And they're the ones that patients often share the information with. And if they're not properly trained to make referrals. So for instance, here's an example. All right, I'd like to schedule you to come in 4 weeks to get that cavity filled. I don't have a car, so I'm not sure how I'm going to do that. So they're often the ones who hear those social determinants of health responses. And if they're not properly trained in how they deal with those, they kind of, say, I don't know what to do about that. And they're right. They don't know what to do about that. They're also the key if it's a practice that only does partial Medicaid, isn't a full Medicaid practice. They're also key to how people are treated when they come in and they're on Medicaid. There are a lot of studies that show that often Medicaid patients are not treated well. So Nancy and I were talking about this before we got started. She said the number one, health predictor is your zip code. And I said, yeah, I actually have that in my presentation. That is true. Research has borne this out. And I was saying when I was in social work and I would take intake forms, when I would hear certain zip codes, I'd be like, oh, this is going to be a problem. Like transportation is going to be a problem. Access to food is going to be a problem. Access to, health clinics is going to be a problem. So it really is true that the number one predictor of your health is your zip code, but that is because the number one predictor of your zip code is your income. So we can all think of where we live and certain zip codes that are very high income, certain zip codes that are very low income. Chances are, if you are high income, you are not going to purchase or rent a home in a very low income zip code. It just doesn't typically work that way. And obviously, if you're very low income, you're not going to be able to live in a very high income zip code. You're not going to be able to afford the housing there. So really, zip code is predictor of income. Income is the number one predictor of our health. It really is. That is far and away the number one predictor of our health. And I love these statistics. It's better to be born rich than born smart. Intelligence is distributed equally amongst the poor and the wealthy. People often don't believe that, but IQ tests done in schools will bear that out, that intelligence is equally distributed. But only 24% of the smartest, the kids that test highest on IQ tests that are low income, only 1 out of 4 will graduate from college versus 63% of the higher income youth will graduate from college. And even if you're higher income, 27% of the lowest scoring, that score the lowest on the IQ test will still graduate from college if they're high income. Why is that? Because their parents can afford tutors, because their parents can afford to pay for 6 or 7 years of college until they finally get enough credits to graduate, whereas lower income families absolutely cannot afford that. I used to work at a college that was 60% first generation students. We lost so many students because, you know, they would need to work too many hours to be able to stay in school. They were working to help support their families. Dad lost his job and the college student had to go to work full time to help support the family. The car broke. They couldn't afford to get it fixed and they couldn't get to school. So, you know, our lower income college students are on the line. Any little thing happens, they're out of school. Our higher income kids have a lot of buffer and they can go to school. I have a friend who went to undergrad for 8 years. His parents paid for that, you know. That's a different story though. So I like to give these statistics on poverty because people are often not aware, even if they work with low income individuals, just how pervasive poverty in America is. So 41% of Americans, almost half of Americans, are what the census considers poor or low income. That's a lot of us. I mean, it's 135 million. 1 in 5 households earns less than $25,000 a year. That is nothing. You know, 2/3 of Americans live paycheck to paycheck. What they mean by living paycheck to paycheck is they generally categorize it by, if you were hit with a $500 bill, would you be able to pay your bills that month? And 2/3 of Americans say no. If I had a $500 bill like a car repair, I wouldn't be able to pay all my bills that month. They are living that close to the line. But I also like to point out that 85% of low-income Americans are employed, because we do have a stigma in this country that people are low income because they won't work. That is absolutely not true. Our low-income individuals are working individuals. This is a scary statistic. 1 in 4 Black families have a net worth of 0. That means they don't own a home, they don't have a car that's paid off, they have no savings. That's scary. You're really living on the line with a net worth of 0. So I talk about this just to say that sometimes when I talk about the social determinants of health and doing those screenings, people are like, oh, that doesn't really apply. It does. You know, it applies to half of Americans are going to have trouble getting through a screening like that without a yes answer on it. So this is the second half of the social determinants of health, that often these two things are talked about separately, and I really believe they need to be talked about together. So sometimes we hear with children, we hear this called ACEs, adverse effects in children. This really impacts adults also. This impacts anybody who's especially living in poverty, but we talk about chronic stressors and how chronic stressors impact our health and our ability to get and complete healthcare. So What are chronic stressors? Poverty, obviously, alcohol abuse, mental illness, food and housing insecurity, physical, emotional abuse, going through a divorce. You have a member of your family who's ill and you're caring for that family. You've lost your job. These, I mean, you can think in your life, what have the really stressful situations in your own life been? And they probably fall into one of those categories. But here's what's really interesting. If you look at these two columns, the yellow column is mid to higher income. The red column is lower income. And then this is the amount of stressors in the average home. And this particular graph is looking at children growing up with chronic stress in the home. So we look at our yellow, our group, our higher income, middle to higher income group, and we see predominantly they are dealing with one chronic stressor. And I look at my own life, we're in the middle of renovating a house. Yeah, that's a chronic stressor. I mean, that's really stressful, but that's pretty much all we're dealing with. And then we look at our lower income families, our red bar, and 3 is the number where research has shown things really start to impact individuals and families. When you're dealing with 3 or more chronic stressors is when it really starts to impact your life a lot. So if we total up the 3, 4, 5 bar, we see about 50% of our low-income families are dealing with 3 or more chronic stressors. That's a lot of stress in their lives. So they may be dealing with job loss and someone in their family has drug or alcohol abuse and maybe they're going through a divorce or a breakup. You know, this is just an incredible amount of stress to be living under, and it's going to impact not only your physical health, your emotional health, and your ability to complete tasks. It also impacts your brain. And this is actually children's brains. And this is, the impact is primarily from the cortisol released when we're in chronically stressful situations. But if you see these children's brains, the one on the left is a healthy brain and you see the brain activity. The one on the right is a child who's lived under chronic stress. This is actually a Romanian orphan who was institutionalized. So this is a massive amount of chronic stress. But as you can see, there are certain parts of this child's brain that just are no longer lighting up and no longer functioning because of the amount of stress this child has lived under. So some children and adults are extremely resilient. They can live under massive amounts of stress and not be impacted. Most people are not that resilient. They will be impacted. So when I used to work a lot in early childhood and with schools, this is something we used to talk a lot about, was how chronic stress impacted children's behavior, their ability to pay attention, their ability to learn and remember things. It also impacts adults. So the research shows that chronic stress is linked to over 50% of all absences. There's your no-show rate right there. It reduces motivation, determination, and effort. It reduces the growth of new brain cells, and it impairs attention and concentration. So if you work with low-income populations, this list will look very familiar to you, and you will see a lot of this type of behavior. And this is generally a result of living with just really chronically stressful life situations. Now, is there anything you can do to fix that? Not entirely. No, you can give the best referrals you can, but a lot of this becomes workarounds. And how do you do workarounds with this? So money can't buy happiness. I know no one believes that, but there actually have been a lot of studies on this. Money cannot buy happiness, but what money does buy is a reduction in chronic stress and access to physical and mental health care. So money does make an incredible amount of difference when it comes to healthcare and when it comes to chronic stress. If you remember that list of chronic stressors, how many of those were related to income? Now, certainly not divorce or substance abuse, that hits all income levels. But if you look at food insecurity, housing insecurity, transportation insecurity, living in an unsafe neighborhood, that is all linked to income. So these are the big questions I get when I talk to dental clinics, especially nonprofit ones. How do you reduce no-shows? How do you help patients understand instructions for home care, whether it's daily hygiene or care following a procedure? How do you help patients follow through with treatment plans? These are kind of the big 3. where dental professionals really, not just, but also primary care, really struggle with when they work with populations who live in stress or low income populations. These are kind of the big three that they really struggle with. So these are my answers. How do you reduce no-shows? That is primarily scheduling and understanding that individuals who are low income are often not in situations where they know their schedule week to week. For instance, if you work in the food industry, if you work in retail, you have a different schedule every week. So it is really being creative about how do you get patients in quickly, so that they know what their schedule is, understanding that a lot of people only have their schedule 7 days in advance. How do you get them in within the next couple of days when they know what their schedule is? A lot of no-shows are not people just not wanting to come in. They're people whose work schedule changed and they can't come in. There's a cool model that we just funded here of a walk-in dental clinic attached to an FQHC. So for people who really have terrible work schedules and they change all the time, or they're constantly having to work overtime, they're creating this walk-in clinic and they're able to tell them, look, just walk in. You may have to wait an hour or two, but just walk in and we'll see you that day. Are you entirely sure that patients are getting enough reminders of their visit and they know how to cancel their visit? Make an appointment with your clinic and try to cancel it. Often people are shocked that they're not able to cancel their appointments easily. And I use my own dentist as an example of this. I got called out of town unexpectedly, and I looked at my calendar, and 2 days later, I had a regular cleaning. Not a problem. I'll just call and tell them I'm out of town. So I call the office and I get the typical recording that says, hey, you've reached Dr. So-and-so's office. We're closed right now. If you have an emergency, call 911. This number does not take messages. Click. Oh, okay. All right. Can't do that. I guess I'll try calling when the office is open. So I call the next day when I have a break, which happens to be lunch, and I get the recording that says, hello, you've reached Dr. So-and-so's office. We're currently closed for lunch. This machine does not take messages. Okay, that's all right, because they're going to send me a text reminder. And when they send me the text reminder, I'm going to respond that I need to reschedule. So I get the text reminder. It says, you have an appointment tomorrow at 10 a.m. Please send C to confirm. And I'm like, well, I don't want to confirm. I want to reschedule. That's not an option. So I think, okay, I'll hit N for no. Nope. I hit N and it comes back. This is not recognized as a response. And I'm like, you got to be kidding me. I cannot reschedule this appointment. I've been trying and trying and trying. So when I finally got a hold of somebody and I went into the dentist and I said, when I rescheduled, and I said, did you know it's impossible to reschedule an appointment with you? And the reason people are no-showing is because they try to reschedule and you've made it impossible. And he said, no, that's absolutely not true. You can respond to the text message. I said, no, you can't. He said, well, you can just leave a message with the front office. No, you can't. And it was like, sometimes people actually do not understand their own system. In fact, not just sometimes, I'm going to say usually, people do not understand their own system. And then have people complete a social determinants form. You're going to reduce no-shows if you know what people are up against. And you're going to know who's most likely to be a no-show if you know what people are dealing with. How do you help patients understand instructions for home care, whether daily hygiene or following a procedure? Number one, understand that most people really have trouble reading. The average American reads at a 9th grade reading level. The average dental information is written at between a 12th and 16th grade reading level. That's college. Now, we've gotten better about that. State Medicaid rules are requiring that things be written at like a 4th grade reading level. We've gotten better at that. I am still going to say that communicating with people in the written word is the worst way to communicate with them. There are just so many people who cannot process information in the written word. Even if they can read it, they can't process it. And here's worse news. They also can't process verbal information when they're stressed. None of us can. When we are very stressed, our brains are on overload dealing with the stress. We cannot absorb information and move it from short-term to long-term memory. So the most stressful place for us, most of us, is the dental chair. And we're getting all these verbal instructions. Believe me, no one can process those. Everybody is so stressed. We're just like, I don't know. She said something, but I don't know what it was. So what's the best way to do it? Record it on someone's phone. Say, give me your phone, and I'll record the instructions on your phone so you have it. Record your common instructions. You guys are given the same instructions over and over and over and over again, right? It's how to brush your teeth, how to floss your teeth, how to care for an extraction. You know, it's the same things over and over again. Record those and say, these are on our website. I will text this video to you so you have it. You can call the office and ask for it if you can't find it, or go to our website if you can't find it. And I know there is a kind of a misconception that low-income people don't have phones. They do. They may not be giving you their number, but most people do have a phone. If you're on any type of government benefits, you can access a free cell phone with data. However, often it's not a number they want to hand out. But if you tell them to go to a website or where they can find video, they will. When I have talked to clinics, the number one call they get after hours is extraction care. So make sure, like, identify your pain points of where people really aren't understanding the instructions, and then make sure you're giving those to them in a video format that people can absorb, because that is going to be everybody's easiest way to absorb information will be on video. How do you help patients complete their treatment plans? First of all, ask them if they want to complete the treatment plan. We always assume, like, here's your treatment plan, and we never ask, like, do you want to do this? Help them understand the positives and negatives of the treatment plan, the positives of completing the treatment plan, the negatives of not completing the treatment plan. People need to process information and understand why they should do it, and understand what will the benefit be to me, what will the positive, negative consequences be to me. We're terrible about that. It's just like, here's your treatment plan. I need to see you in 4 weeks. And we don't ask if this is something they actually want to do. If they don't want to do it, guarantee they're not going to show up. And then ask them what barriers they might face. You know, do you think there might be any problems in completing this plan, like with transportation or getting time off work or being able to get in here? Do you think there might be any issues with that? Ask those questions directly so you can address those problems if they're there. And then make sure you're working with their schedule, because, you know, so many of our, especially low-income individuals, cannot easily take off work, cannot leave work in the middle of their shift. Their days off fluctuate, and we really have to be. It does add a whole layer. It does add a whole layer of difficulty to working with people. I love this quote. Because it is so true. I often hear people say, you know, I don't have a lot of compassion for lower income people, because I worked for everything I had. I put myself through school and I worked hard. Yep. I have no doubt that everybody's worked hard to get to where they are, but some people start from a very different point than others. And I love this quote that says, if you started with a good pair of running shoes, that was just luck. And there are people starting a mile behind barefoot, and that's where they're starting the race, and they're going to have to run so much farther to get to the same point. And I always try to remember that. I come from a really low income background, but I will say there were certain things that I started with, you know, and that was innate intelligence and family who really supported me and things like that. And there were people who started way behind me. And so while I do get that, I always really want to stress that some of the hardest working families I've ever worked with were some of the lowest income. and working just incredible amounts of hours and getting very little compassion and understanding when they couldn't make appointments or when they couldn't finish things because of their life circumstances. And I think that's really what understanding the social determinants of health is about, is understanding where people are starting and just how many barriers are stacked against some people when they are trying to get the things done that maybe you and I find very easy, like going to a dental appointment. So that is all I have, and well, today. And but I'd like to let me close this down, because I always would like to do more asking questions than talking, or I mean answering questions than talking.
Yeah, thank you so much. I took so many notes, and I was taking notes like crazy. I thought, I don't usually do this, but I have so many great points that I got out of it, and I know others did as well. We have one question I want to start with. It's, can you comment on the use of dental navigators?
They're great. That would be my comment. So I worked as a patient navigator really early on my career as a navigator for cancer patients, and actually developed for the American Cancer Society. This was like 23 years ago, their first manual on patient navigators. And that is a phenomenal model. And patient navigators, if you're not familiar with a patient navigator, their job is to navigate a patient through the system. So they're really working with those social determinants of health screenings. They're identifying people who have problems with transportation, problems with anything, that could impact their ability to access, to be able to come to appointments. So I work a lot with disabilities. We have a really strong commitment here to the disabilities population. And I was at Penn Dental Medicine. We send people there for immersive training in disabilities, dental staff, all dental staff from front office through dentists. And their patient navigator, to give an example, calls patients before their appointments and just says, hey, your appointment's in 3 days. Just want to give you a reminder and want to see if there's any help you need getting to your appointment. Do you have a ride? Do you have, are you able to get off work? Has your work schedule changed? Whatever it is. And then if the patient says, well, I don't have a car, my neighbor was going to take me, but now she has to work. Okay, let's line up a ride, And so patient navigators are really not only helping people get to their appointments, but they're also helping them navigate the insurance system. They're helping them navigate billing. They're helping them navigate any of those barriers that they're facing, like food insecurity or housing insecurity. They're giving them those referrals, and then they're following up and making sure that those referrals were, that they were able to get the help that they needed. I think any nonprofit dental clinic should have a patient navigator, because you will see a huge reduction in your no-shows and a huge increase in your completed treatment plans with a patient navigator. They're just phenomenal.
Thank you so much. And someone asked about your email, and I said if you could repost it, and then I'll send it out to everyone who. And
it's, yeah, I had it on that final slide too.
Yeah, and I'll send it out to everyone following this. Couple of things that I took notes on, the idea of not being able to cancel your appointment. I had that recently with a pharmaceutical, and I didn't want it, and there was no way. And I think I got 30 texts from CVS, and it was just, same kind of thing, trying to call. Let's see. Yeah, so the front office staff training and resources. I think that your points about having resources, having referral services, really, really important. And the other thing I thought of is many of the people that are here today, if they never heard about social determinants of health, as you were talking, they were probably saying, oh, I had a sense of that, or I knew about that, or I witnessed that in my work. I just didn't know maybe that there was a term for it.
Yeah.
And
We've all known that, right? Like we'll all
yeah,
talk about a client or a patient be like, oh, she's really going through a lot right now. Like she's going through a divorce and I think she might lose her house and she lost
right.
her job. That's, we all intuitively know that, like when people are going through a lot,
Mhm.
that's going to be a real problem with them being able to follow through on things and access care. And this is kind of giving it a name to something that we've all kind of intuitively known.
Well, and I think the benefit to giving it a name is, as you said, there's research done on it now, and you have given everyone so many ideas for how they can use the social determinants of health to better help their patients.
Yeah.
To
And the
access their care.
screenings, the other important thing about doing a screening is then you can start to track data. And you can really start to look at what are the number one barriers that our patient population faces. And then you can start going after funding to address those barriers. So you can say the number one reason that our patients can't make it to meetings is transportation. And that gives you, the data that you need to apply for perhaps, funding to be able to pay for transportation for people if they're in an area where they can like get an Uber and you can just use that, or you can pay for bus cards or gas cards or whatever. Or in some cases, I've worked with groups who just bought their own transportation and go and pick people up, and so, but it gives you that data to know what are our, instead of just like, I think a lot of our patients have problems with this.
Right.
It gives you that real data to say, gosh, 30% of our patients have problems with transportation. We got to do something about that.
Right. And do you think the WIC screening, the home environment screening, that the form that you showed us, is that something you could share with us?
Yeah, I can share that one. I can also share the one that we're doing with the nonprofit dental clinic here in Michigan. That's more of an adult oriented one. The WIC one was very much oriented to people who had young children, because everybody in WIC is either pregnant or has a child under 5. So it asked about childcare and asked about things like that. Probably the better one is the one out of Michigan that we're working with. And I can request, we've been revising that so much, I don't even know if I have the final copy, but they've been doing that probably for about, they've been implementing that in their clinic probably for about the past 4 or 5 months. And they are implementing through a community health worker. And they actually have a community health worker that they've hired to basically she's working as a patient navigator, but she is a community health worker. And that is simply because in some states you can bill Medicaid for community health workers. And in Michigan you can. So it behooves you to hire somebody with that certification or to have them get that certification, even though technically the job she's doing is a patient navigator. And so what she's doing is anytime you hit a yes on that screen, boom, you get pushed over to her and she's going to follow up with you, give you referrals. And then if you have a treatment plan, then she's really going to work with you and make sure that you're able to meet that treatment plan, that you want to do that treatment plan. And if you don't want to do it, she's going to help convince you to do it, that it's in your best interest. Because you know what, people, and I know anybody who works in the oral health field hates to hear, how much people don't like going to the dentist, but the reality is they don't. And so sometimes when people get a treatment plan, that's like in their minds, they're thinking, there is no way I'm coming in here 5 more times. You cannot make me do this. So it does take a lot of, kind of education and motivational interviewing and persuasion to help them see that it would be in their best interest to complete that treatment plan and that they would feel better and they wouldn't be in pain and they'd be able to work and enjoy their life. And, it takes a little bit of persuasion.
I think in the end, the tools that you've given us and talked about, they're really about connecting with the patient.
Yeah.
That's what I keep feeling from what you're saying is you're connecting with them. We're finding out where they're coming from and what we can do to work together with them for better oral health. I mean, yeah.
That really, you're right. That really is it. And it's seeing patients as people and humans and connecting with them. And often we lose sight of that because we're so busy and so overwhelmed, and no-shows are frustrating, and not completing treatment plans frustrating. And it takes work. And often the dental provider is not the person to do that work because they have their own work of being a dental provider. So it's the patient navigator, it's the community health worker, it's the social worker who's the person who does that kind of work that gets them in the dental chair.
It looks like we don't have any other questions. We do have some thank yous to you.
Oh, that's nice.
Yeah.
Very welcome.
Yeah, on behalf of our coalition and all of our attendees today, thank you so much. I thoroughly enjoyed this, and I'm going to speak for everybody and say that we really appreciate it. And yeah, it was just super helpful.
Well, thank you. And thank you for the very nice thank yous. That's lovely. And somebody wrote that, dental professionals need to understand that despite our skills, which are incredible, that it takes a team. And I think that's a great observation, that sometimes it takes the team to get the person in the chair so you can do your great work, because they're facing a lot of barriers just to being in that chair. And that is a team effort. And I always let dentists off the hook here, because it's their job is to fix teeth. It is an entire team effort to be able to help people overcome the barriers they have just to being in the chair.
Yeah, this is wonderful. And what I love about our community is that everyone does want to help others, and that's why they're all here.
Yep, absolutely. That's the great thing about coalitions. And I was really shocked to hear how big yours is. I mean, I was like, gosh, I thought we were doing good in Michigan. We're not doing that good.
Well, I appreciate it. It's a great group. And so I just want to say to everyone who's here, if you have ideas for other presentations or presenters, just let me know. This idea came about, I had a great conversation with some folks, and I said, oh my gosh, let's find someone to do to help us learn more about social determinants of health. And that's how this happened. So yeah, thank you very much. And thanks everybody who attended. And we look forward to seeing you at our next event.
Thanks.
Yeah, thanks so much. All right. Bye, everybody.